This fire is extremely dangerous and moving with no regard for what's in its path.
We can't say it enough. If you're in the area, get out.
That night, the fire made its own path, jumping large barriers and feeding off itself in the form of a tornado.
In this situation, everywhere you drove, it seemed like you were driving into more fire.
My story actually starts on Wednesday night. When Whiskeytown Lake was burning, you can see the fire glow from my backyard. So I watched that through a good portion of Wednesday night. I was getting closer and closer, and at some point in time I needed to get some sleep, so I did. And when I woke up in the morning on Thursday, it was very still. Did not hear or see the fire. I got my 2 children ready and started gathering some of my disaster supplies together because I just had one of those feelings that Thursday was a day that I'd be gone for a couple days.
I was out of town with my husband, Daniel. We were in Montana hiking when we got a call that we were being evacuated. We didn't understand the severity of the situation because we weren't present, but we were constantly thinking about it, concerned for our friends and family who were here working amidst the fire. So I made sure to check in. I said, how are we doing? How are our people? You know, what's our plan? Do you need me to come back right now? And everyone's like, you know what, it's okay, because they were trying to protect me. They knew that my house was gone. So my husband and I had a discussion and we decided to come home so that we could start taking care of things.
That Thursday morning, we knew it was pretty serious and that we were possible for evacuation. And but I work at 5 in the morning, and patients have to eat, and it's hard to replace someone that early. So I decided to go to work, and I cooked breakfast for patients that morning. And everyone's like, "What are you doing here? That fire's pretty close." And I said, "Well, you know, my wife's there, and once I get this done." So meanwhile, we serve all the patients their breakfast, and I check on my wife, and she's like, "Hey, the neighbor just came by and said we're definitely gonna get evacuated."
We never thought we would never come back. I mean, we're still not back. We've got to come out and see our home, what's left, but never thought we would not have a home.
I stood on the roof and saw that we were surrounded by fire. I didn't believe for a moment my house would burn down, but I also couldn't see how I was going to survive. Everyone reached out, lots of phone calls, lots of texts, you know, and I have to say I was shocked by all the attention, and I didn't know what it was really like to be a receiver. I guess I'm just more of a giver in general, and so to be on that end, I have to say it was really helpful. I couldn't imagine getting through it without all the support. I've never been in need of so much support before.
I would look at our staffing for the day, and almost all of us have lost our home today, and we're all here. And it just it's a heavy feeling knowing that your work family is going through a similar tragedy, but it's also an odd comfort knowing that they know what you're going through and that everyone's here choosing to serve at the same time that you are.
It was just amazing. Their attitudes, their spirits, it wasn't like they lost anything. It was more like, I have to be here and I'm gonna give back. You just seen the normal person that was at work.
And that's the crux of Dignity Health, is we are one very large family.
So much support from my team and my family, and I feel really blessed to work there, really blessed to be a part of it. It's like work just wrapped their arms around me and gave me a big bear hug.
Dignity Health is just a big community of their own, and we're going to show that you can't take us down.
Yes, we lost our homes, but the homes room's gone, that's not going to change. What we could do that was positive was serve our community. And that is what calls us to work at Dignity Health, is the opportunity to serve our community. The community needed us, and so we were there.